Hello, Kansas chiropractors. If you enjoy treating patients with hands-on manual therapies that get them better quickly, I have two classes that I think you're going to like. My name's Tim Bertelsman. I practice in Illinois, but I'll be in your area in Lawrence, Kansas on April 9th and 10th for your annual convention. On Saturday, we're going to talk about the rotator cuff, the most common diagnosis outside of the spine. We'll talk about what goes wrong and how you and I can solve that more efficiently. I'll tell you what the research has taught us as far as the most sensitive and specific tests. We'll talk about the functional deficits that delay recovery, and we'll talk about the exact recipes for treatment and exercises that help these patients get better. The two highlights of this class are, number one, we'll talk about shoulder mechanics and how when it doesn't work perfectly, the patient has problems. We'll talk about how as manual therapists, we can restore that motion. And number two, we'll talk about a paradigm shift in treating the shoulder, going from what we used to think we needed to suppress inflammation in a chronic tendinitis to recognizing there is no itis in chronic tendon problems. It's an apathy, so we need to initiate a controlled inflammatory reaction. Our treatment has changed more dramatically in the shoulder than any other area in the body in the past decade, and I'll tell you exactly what that looks like. That's day one. Day two, we'll talk about the most common diagnoses that we treat, and that's the lower back. We'll talk about lumbar joint dysfunctions, disc lesions. In fact, I'm going to bring along a disc nucleus. We'll talk about the structural diagnoses, including the most sensitive and specific orthopedic tests. I'll have live or hands-on video demonstrations of every assessment and treatment and exercise that you'll need to improve your recipes for those diagnoses. More importantly, we'll talk about the functional problems that are delaying our patients' recovery in the lower back. Those 1 in 10 patients who aren't getting better with our typical treatment, we're going to figure out how to solve those by identifying hip abductor weakness or the inability to pressurize because their diaphragm isn't working well when they breathe, or maybe just core instability. We'll also talk about a classification system for treatment so that you can make better treatment decisions. Have you ever wondered why one patient improves with manipulation and another doesn't? One patient loves traction and the other one feels much worse after traction. Some people like knee to chest exercises and some people like extension exercises. That's no secret. There's a very clear classification system that can help us make the right decisions the first time. I'm going to present this information in as straightforward and practical manner as possible. I pledge to you that my goal is to give you practical skills that you can use on Monday morning to help your patients get better. If that sounds good to you, I'd love to see you at those classes. Thanks for listening, and you can register on the KCA website. I'll see you in Lawrence on April 9th and 10th.